Hi, everyone. Do a case study on how in the European Union, how healthcare systems have been supported to strengthen their capacities in rare diseases. So I just wanted to try and give you some examples of what type of support has been put in place in the EU and in some of the member states to give you food for thought. In the European Union, which was 28 countries and now 27, come together and identify areas where they can be European added value by leading on stuff at a European level, supporting member states at a national level. And rare diseases is one of those areas where it took about 10 years from 1999 through to about 2008, 2009 for the narrative to develop around and the rare diseases, that no one country can solve the problems of rare diseases poses by themselves. How does that recognition of rare diseases being recognized as a public health priority sort of take root in the European system? And actually in 2008 and 2009, we had two political declarations of support. One was from the European Commission, which was a communication from the European Commission on rare diseases. And then we also had the Council, the European Council, having a recommendation on the actions in the field of rare diseases. These two documents were the net sum of 10 years of work and provided political support for the community and for hospitals to engage with the European Commission and with their member state leads to take action. So political support is something which is really important to nail down. And, you know, at RDI, we've tried to do that, looking at the UN system around having a UN resolution to tackle the challenges of people with the rare disease and their families. So in Europe, this was our big sort of milestone. And actually, the council recommendations here highlighted a number of actions which needed to take place. One being around member states developing national plans and strategies. Another one around development of expert centres and also a European network of those centres coming together, promoting greater research in rare diseases. So these became the key tools which supported action over the next 10 years from 2008 to 2009 to date. Those communications and recommendations are, you know, soft in terms of their political power, but we have also a hard regulation, which a directive, which also nailed down that need to collaborate cross-border under the European Union, and that was under the Cross-Border Healthcare Directive. So before the Cross-Border Healthcare Directive, the idea of cross-border collaboration in rare diseases wasn't established, and we had running in parallel from 2004 to 2014 the development of this directive, which gave 4 areas where we should do cross-border collaboration: one around the European reference networks, around rare diseases, e-health, and HTA. This is a bit of a visualization. So the first 10 years were about forming that common public health message, and that you hear people saying that rare diseases no one country can solve by themselves, and it's an area of European added value for collaboration. And then after that, you can see here the next 10 years were about doing something called community action. So turning that political support into concrete resources to implement action. So the two things which I'll talk about in a minute was we organised a joint action for rare diseases. It was called a EURORDIS action, and that enabled us to develop the guidelines and policies needed in the field of rare diseases on a European level. And then the second joint action looked at implementing them. You can also see here that from the establishment of the cross-border healthcare directive, we then had which the ERNs were in, then they were implemented under a second bit of legislation, and then from 2016 to date, those networks have been established and expanded. So you can see 10 years of advocacy and 10 years of action. So the question is, now we've had those political support given in 2008, 2009, and we're now 2022, is the job done? And actually, do we need to have a refreshed political commitment? And actually, we believe we do. So EURORDIS has led a European project called RARE 2030, which enabled us to look in 10 years' time, where would be our healthcare systems be in tackling rare diseases, and what would be our favourable scenario. So from this document, we realise that we need to refresh that political support. And today, the Commission works in a different way, and actually everything's an action plan. So we want to develop an action plan for rare diseases, a European action plan, to refresh that political connection, to enable lots of activities to happen over the next 10 years. I mentioned about the expert groups. So we had in 2010 to 2013, EU Committee of Experts of Rare Diseases, EURORDIS, and then after that, that became a European Commission expert group on rare diseases, and both of those groups did the policy guidance, which once we recognised that there was a public health need in rare diseases in the EU and community action was needed, what action was needed, these groups came together and provided the technical support to saying, actually, if you need to develop an expert centre, what's the quality criteria to describe an expert centre? If you're going to develop a European network, what does that European network look like? So these were pretty much the think tanks in the first period on these sets of recommendations. And then in the second, from 2015 onwards, we had a second joint action called RD action, and that looked at implementing those policy guidelines, like supporting the development of the ERNs. So this was a technical support which was given. So I mentioned political support. This is technical support which we needed. And, lots of healthcare systems are different. If we look at Africa and how the different healthcare systems take different approaches, could there be a community of people coming together under an expert group or a committee coming up with recommendations which are relevant in Africa for those healthcare systems? That's what we did in the EU, and it was really helpful because they gave us the policy guidelines. One of the other things which was in that first council recommendations on actions in rare diseases in 2009 was about having development of national plans. Well, national plans don't just pop up in the EU from this the recommendations from the council. It highlighted that each European country should develop a rare disease action plan or strategy. And so what we did was, under one of the joint actions, which I just talked about, we developed something called Europlan conferences. And these conferences were there to be held at a national level to bring together the key stakeholders. They were organised jointly with the patient groups, with the ministries of health and the clinicians and researchers, and saying in France, in Germany, in the UK at the time, what does our national plan need to look like? What should it cover? And so we had, at the start of 2009, we only had 5 national plans in place. That's developed consistently now, and I think most European countries have them in place. Some are on their 3rd version. We also had we held between 2010 and 2018, 59 national, these Europlan conferences in the 25 member states plus countries around. So you'll see lots of countries around the EU are looking to what the EU are doing and developing a similar approach. So this is a visualization of the countries with national plans. Some, as I said, are on the second plan or third plan. And those national plans are absolutely key because they provide the political support nationally to drive action. So I mentioned about technical support, I mentioned about political support, and now there's something called administrative support. In the EU, we have the European Commission provides an administrative support to member states to coordinate and to support them implement different initiatives. For the ERNs, for the European Commission provided that technical support, that administration support in the background. So they were the secretariat for board member states coming together to form a board of member states to oversee the development of the European reference networks as a governing body. They also provide the secretariat support to the network coordinators group, where all the 24 network coordinators come together. The European Commission also scoped out what would the application process and assessment process look like to join. They also worked with the the ERNs to develop the monitoring framework, and now they've just developed the evaluation framework. So that's administrative support, which actually we would be pretty lost with if we didn't have it. I think one of the key bits of learning, I think from my side, it's probably a personal view, is what we don't have at the moment is an expert group like the EURORDIS providing that policy guidance. So at the moment, what's being implemented is very technocratic, it's very administrative, and we're missing at the moment that more strategic group looking forward, saying where we need to go next. When the European reference networks were set up, in the application process, and I won't go into detail on this, but actually every hospital which expert team who was wanting to join an ERN had to get support from a letter of support from their hospital chief exec as part of the application process, and also an endorsement letter from the member state lead. So that is a support for them to join and be active in the network. And actually, as we've gone forward with the ERNs and we're at about year 4, looking at the value of that support is actually being further developed. In the second call, this letter from the chief executive became a lot more specific, saying that each of the expert teams needed to have data manager support to be able to report into the ERN system, etc. So it's, I think that's also an added aspect of support. This is the IT platform to which the European Commission developed to provide infrastructure to support the collaboration in the ERNs, a whole purpose-built platform, and it's being developed further now, but it does the job, and I think it's a key bit of support to enable collaboration cross-border. So normally when people think about support, they always think about the money. And this is where everyone sits up, because I've left this towards the end. There is financial support, obviously. Now, financial support can come in different guises, and this is a focus on financial support. So the European Commission provides financial support under the joint actions for people to come together to do community actions like development of Europlan conferences, etc. So that's one vehicle to enable funding to be channeled to broader stakeholders in the community to tackle that public health challenge. The European Commission also does, the health programme has grants which were given to ERNs. These were pretty much like anchor grants, but those anchor grants were not 100% funding initially by the European Commission. They had to be 40% co-funding from the hospital. So any centre which was taking part, who was a coordinating centre, their own hospital would need to pay a certain contribution to that centre being a lead centre in an ERN. Other types of support came in terms of funding for registries from the European Commission. We also had some of the voluntary contributions and in-kind contributions. So some of the hospital chief executives approved some funding for staff internally, like project management support. So that was funding not just coming from the Commission, but also from the hospital. Member state support. France is a really good example. Under their French national plans, they support their coordinating centres of the ERNs with about 50,000, I think, euros to enable them to provide that support and leadership to the networks. And they also virtual consultation, you know, who pays for that? Well, at the moment, it's pretty much voluntary contributions from the experts and support from their hospitals. But I believe under the third national plan in France, that experts in France in the ERNs, when they upload a case into the clinical patient management system for virtual advice, they will get funding for them uploading. So it's not funding for giving advice, it's funding to support them to upload into their system. The financial support also comes under different types of tenders. I'm not going to read these in detail from the European Commission. Also financial support for research. So there is the European Joint Programme and different types of research grants which are available. We've started a new financial multi-annual annual finance planning, MFF, multi-annual financial framework, that's it. And that governs the funding of the EU over a 7-year period. And so the funding in that comes under something called the European Social Fund, and the health programme is under that. So we have in this specific funding which is being given to the networks, and that's been increased because of good advocacy by the networks themselves and the patient community. So we now are seeing that anchor grant from the European Commission to being 100% funded by the Commission, no co-funding, plus the amount is increased per network. The last bit, and now finish, is there's also some funding support which is given via a different mechanism called the European Joint Programme, which enables research calls to take place over the period it's finishing now, to coordinate capacity building and different types of activities in terms of supporting the ERNs and the research community in Europe to come together and develop research. So that's a different type of mechanism which in the EU they've taken, and now this is concluding. They're going to refresh it under something called European Rare Disease Partnership. Thank you.